one of the things that they do at Causenta Wellness is they institute and implement alternative therapies. Are there other treatment alternatives for triple negative breast cancer patients that perhaps you implement at Causenta that would work for women that are diagnosed?
Yeah, there sure are. I mean, so first what I would say is that when we do a workup of a case, we look at other things going on in that person's body. So for example, do they have coagulation issues, meaning their blood has got a high potential for clotting? Do they have inflammatory markers like homocysteine, a lipoprotein A, or some other things like an erythrocyte sedimentation rate or CRP markers that are elevated? We try to address those markers through exercise and nutrition. And then we follow up and test those markers so we could verify they are improving for that patient. And if they don't improve, then we try something different. It's that straightforward. So one way or another, we're going to find something for that individual that will help them. Now, in terms of cancer fighting, part of that, it depends on the uniqueness of that situation for that individual. But as an example, we could look at tools, for example, if a woman has trouble managing her glucose levels and they're running high and exercise alone and diet changes aren't controlling that glucose, then we could look at tools like metformin. If someone wants, let's say, an inexpensive drug option. If someone says, look, I don't want to use medication for whatever reason, we could look at natural strategies like alpha-lipoic acid with berberine and hydroxycitric acid, or even Gymnema sylvester. Those are other options to control glucose levels in the blood. If someone says, hey, I'm not comfortable with doing a fully chemotherapeutic regimen, we can look at ways of creating some alternative medical options for them that we can test for them. And if they see their tumors are shrinking or their cancer activity is going down, then they know to stick with it. And if it doesn't work, then they know, hey, I better try a more aggressive regimen involving some chemotherapeutic agents. Because from our perspective, at the end of the day, we want results for our patients. And so, we're going to have lots of tools that we could look at and explore with each individual.